Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of Faith understand the legislative process and help you engage with public policy in the great state of Texas. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and y'all, what an incredible week this has been. The Texas Impact team just worked with some incredible faith partners on the Family Matters Faith Days at the Texas Capitol event. About 300 Texans of Faith gathered at the Texas Capitol and across the street at First United Methodist Church of Austin for 3 days of education, advocacy, and activism. And first of all, it had such great energy. From the time we gathered on Sunday evening for dinner about public policy and faith, when we had to roll out more tables for the overflow crowd, until we concluded with singing and prayer in the outdoor rotunda at the Capitol Tuesday afternoon. But what struck me most about this event was the diversity of both the participants, but also the opportunities to engage. I think we had at least 8 legislators come speak to the group at various times. We had legislative visits to Capitol offices, singing in the rotunda, great panel discussions, a rally on the south steps of the Capitol, and of course the part that got the most attention in the media, a press conference dubbed Texas Women of Faith Support the Life of the Mother Act press conference. At the press conference, B highlighted the postcard that many of you, along with 6,000 other Texans of Faith, have signed calling for Texas to fix the abortion ban. And so it was a celebratory moment to be in the Capitol for a press conference to highlight a bill that would do just that. A room full of Texas women faith leaders spoke in favor of the bill, and the author of the House version of the bill, House Bill 44, the Life of the Mother Bill, Representative Charlie Geren, spoke, saying that in his 24 years of legislative service, this is the most important bill he has ever carried. You can watch that entire press conference on Texas Impact's Leg TV channel on YouTube. And we're going to talk about all of that today with one of the Texas faith leaders who spoke at the press conference, Reverend Jessica Kane of Living Word Lutheran Church in Buda. She also serves as a Texas Impact board member. So let's jump right in for this week's conversation with Reverend Jessica Kane and Texas Impact's policy advocate working on reproductive health issues, Reverend Kyle Riley. Joining us for this week's conversation is Reverend Jessica Kane, pastor at Living Word Lutheran Church in Buda and a Texas Impact board member, and Reverend Kyle Riley, policy advocate with Texas Impact, who, among many other roles, helps staff our reproductive policy team. And Kyle, I think that was the first time I've publicly introduced you as Reverend Kyle Riley, so I loved that feeling.
In a minute.
So you were both at the Capitol this week for the Faith Days at the Texas Capitol. Have you recovered? How are you feeling? We're in the middle of Texas Legislature. Life is good. How are we?
It is just like it always is about this point in the legislature, where I feel like we've done really good work and so much time has passed, and yet there's still so much to come.
Kyle, how you hanging in? First legislative session on staff?
Yeah, it feels a lot different. I thought I knew what I was getting into after advocating last session, but things are a lot more intense when you're really tracking all the bills that are out there, and walking around the Capitol all day, sitting in committee hearings, all that kind of stuff. But yeah, I really echo what Jessica said. It feels like we've been at this for so long, and yet there's so much longer to go.
Halfway there. We're almost halfway there. So we are in the heat of the legislative session. I said in the open of this episode, I felt so much energy coming out of the event this week, out of the Faith Days at the Texas Capitol. 300 people doing all kinds of activities. But one of the highlights of that event for most folks, and the one that certainly got the most media attention, was the Texas Women of Faith Support the Life of the Mother Act press conference this week that highlighted 2 newly introduced bills titled the Life of the Mother Bills, Senate Bill 31 by Senator Hughes and House Bill 44 by Representative Geren. That event was certainly fantastic, and I know there was a lot of energy that came out of that. But this is an issue that's been a hard topic for years, and there's been a lot of debate, a lot of conversation around the medical emergency exemptions and how we can do better to protect the life and health of mothers. And these bills would certainly do that if they were enacted into law. So, Jessica, starting with you, because you were one of many Texas women faith leaders who spoke at that press conference. Also, wonderful job. Thank you for doing it. But this is an issue that's got a lot of attention over the years. But I know you're involved in a lot of different issues. So why was it important for you specifically to speak up on this issue?
I think it's important for people of faith to speak up on all kinds of issues. And I've talked a little bit this session about how important it is to really focus in on the ones that we are most passionate about and have the time to engage in. So I've told multiple people, education is going to be my top priority this session, but that doesn't mean we ignore the other ones. And when the abortion bill first came through, I think that was 2 sessions ago. Is that correct? Yeah. We really advocated that it be clear. We have all sorts of opinions about abortion across the faith community, but what we had asked for multiple times from across that spectrum was whatever this bill is, whether we really want it or we really hate it, it needs to be very clear about what it is. And it was not clear about what a medical exception is. It was not clear about what cases would be an acceptable time to have an abortion under the law. And so we've just been asking for, 4 years at this point for those medical exceptions to be very clear so that doctors can act quickly and for the sake of the life of the mother.
And this shouldn't be controversial. I know it probably is, but it shouldn't be controversial that the Texans of Faith speak into this space to protect the life and health of mothers, right?
Absolutely. Like I said, abortion is such a controversial issue, but this one narrow piece of it really does seem like a place where we can all come to an agreement that doctors should be able to do what they need to do to save lives, period.
Chaos is bad in the medical sphere, and clarity is good. So yeah, this seems to fix a lot of those issues. Talk to us about the press conference, because you were standing there with a very large group of women faith leaders. Representative Geren came and spoke passionately about House Bill 44. What were you thinking coming out of that press conference? What reflections did you have?
I was really thinking about how amazing it is to have the ability to fill a room like that. I expected, because of the way, I think it was actually Kyle was talking about, well, there's not a lot of space, so we're going to let these folks in first and we're going to see who else fits. I was expecting a really tiny room, and it wasn't as tiny as I expected, but just seeing it completely packed with folks who were there to either say something important about this bill or to hear something important about that bill. It was just a real moment of, this deeply matters, and there's plenty of people surrounding us, even in these somewhat scary moments of speaking to, we don't know who. That was, I think, one of the most interesting pieces for me was, I have no idea who's going to see this and when. And later that night, I got a text from one of my parishioners who said, "Hey, you were on the news." And I thought, which thing did I do? Am I in trouble? What did you think? And it, being in the press conference was that moment of, I don't know where this is going after this, but I know it's going to do amazing things for people to hear these words of this amazing group of women.
So full disclosure, and don't tell the boss this, I was not at the press conference because we had an event going on and legislative visits at the same time. So I was in another room dealing with other parts of that event. And I didn't watch the entire thing until this morning. But certainly when I got home, it was all over my social media feed. And so I think a lot of people saw it, both on social media and through the media. So appreciate your willingness to participate in that. And yeah, I think it is making a difference. Kyle, I want to bring you in because we've referenced the bill a couple times. We've given the bill numbers and talked kind of generally about the issue. Talk to us about the bill. What is it and why will it make an impact?
Yeah, so the bill does a lot of really, really important things. So to give you just a brief summary, the bill really improves the safety of pregnancy for quite a few people in the state. We've seen a lot of cases of people being denied medically necessary abortions and unfortunately dying as a result of that because doctors were fearful of providing them care. And so this bill does a few things. It allows doctors to provide evidence-based medical care. That's one of the things that we're really stressing about this bill. It clarifies the language in the existing law, either by striking out certain definitions that were really confusing and making those more clear, or just adding a bit more language that aligns with what doctors are familiar with. And it allows doctors, like I said, to practice evidence-based medical care. That's the bottom line. Doctors know what they're doing, and we need to trust them to know when an abortion is necessary to save the life of the mother. Um, this bill also protects and trusts that doctor-patient relationship. It allows doctors to have conversations with their patients about what might be necessary based on their conditions. Um, and kind of in line with that same thing, there was a lot of concern when the bill first came out, when SB 8 first came out, and we had the abortion ban in place about what construed aiding and abetting under the law. And this bill would redefines and clarifies what aiding and abetting means, and it puts the emphasis on the doctor's actions. So the doctor is now able to have conversations with lawyers, to have conversations with other medical providers, and ultimately it's that doctor who performs the abortion who is under possible penalty if the abortion were to be seen as illegal. So that really opens things up for providing the best medical care possible without other people who might be involved in those conversations being fearful that they would somehow be considered to be helping in an abortion that was ultimately considered illegal. And one of the other things that we really want to stress is this now puts the burden on the state to prove that an illegal abortion took place. So that was not the case before. That was really unclear about how we were going to prove whether an abortion was an exception under the law. And this now requires that the state prove, first of all, that an illegal abortion took place and that no reasonable medical physician would have said that the abortion was not necessary. So that feels kind of vague to some folks. I know that can feel more scary and add some room for interpretation, but the doctors that we've consulted about this leading up to this, everyone who's worked on the bill and the language going into it is sure that this is going to provide some of that clarity that doctors have been urging the legislature and the medical board to provide, and to allow them to have evidence-based medical care and provide that in the best care to patients around the state.
On our Marching Orders Monday Zoom, B talked about this being a perfect bill. And that's not something I've ever heard her say before. This is a perfect bill. We're so excited about it. But it is important that this bill move forward without amendments. This is a negotiated bill. Any changes you make will cause somebody on one side or the other to pull out. Talk to us about the importance of keeping this bill intact as is with no amendments.
Yeah, so there are things that this bill doesn't do. This bill doesn't have exceptions for fatal fetal anomalies. That's something that a lot of folks have been asking for, but that's not what this bill's addressing. And this bill is a perfect bill to address exactly what it's addressing, right? It's allowing doctors to save the lives of moms in medical emergencies. And that is very, very important that we pass that bill. And this bill has gone through a lot of processes before it ever hit the filing desk. And we had a lot of people come on board beforehand about, who especially from the faith communities, where would there maybe be some pushback, who was going to be on board. This again, like Jessica said, this is a difficult topic, and we acknowledge that, but at the end of the day, this bill is about saving people's lives. And as it's written, that's what it does. And it has bipartisan support. There's a lot of co-authors on the Senate bill. There's a lot of authors that have come on. Representative Howard and Representative Johnson have both signed on as co-authors with Representative Geren in the House bill. And having that bipartisan support is, as you know, Scott, kind of a fragile thing here in Texas. So making sure that this bill stays exactly as it is and exactly as people have signed on, both from the faith community and from the representatives themselves, is really, really important to make sure that this bill passes. Because for this bill to pass, it would really make it a lot better for some folks in the state to receive the medical care that they deserve.
Thanks, Kyle. I'm going to open this up to both of y'all because this is a bill that will make significant impact in the lives of people here in Texas, moms here in Texas. So talk to us about how this bill would improve the lives of women.
In the press conference, in case folks who are listening to this were not able to be at that or listen to that as well, one of the speakers talked about multiple families that they know who have either chosen to not have children at all and to ensure that they will not have children at all, or have chosen to leave the state of Texas so that they can start families. Not knowing what might happen with your body or your family or your loved one if they become in danger because of a pregnancy is a really terrifying place to be. Many women have faced miscarriages, have faced complications in pregnancies. I myself, I have 3 kids. I had 2 miscarriages in between a couple of those. And if I had not been able to receive good medical care, there's no telling whether I would have the other 2 kids or not, whether I would be here. And so it's just deeply important to make sure that women, moms, parents know that they will be taken care of in the event of some sort of emergency. It's important for individuals, but when we're talking about Texas as a whole, if we want to continue being the state that has a surplus budget every year, we need to have people who are going to live here and raise families here and stay here for their entire lives. So there's just all sorts of implications of this seemingly really small thing passing through and changing the course of medical care for people in the state.
We've heard a lot about doctors leaving the state, like Jessica was sharing. At our UWF conference, we heard from Dr. Charlie Brown, who was sharing that the numbers for medical students applying to stay in the state, or excuse me, the number of medical students coming to the state and who then subsequently stay here after their training has really dropped, not only for OBGYNs and that specialty, but for across the board medical physicians coming to the state and staying here. And that's impacting everyone. That's not just impacting people who consider themselves pro-choice or pro-life. That impacts everyone in the state of Texas. And people who worked on this bill beforehand, us ourselves, were all really hopeful that allowing doctors to practice evidence-based medicine will not only, like Jessica said, ensure that families feel safe to expand their families, to start their families in this state, but that doctors feel safe to come to this state and practice medicine, no matter what their specialty is. And that's something that's going to help the entire state.
You both know I love our weekly homework assignments, but I know our folks are excited to get involved and figure out what they can do to help push this forward. What do y'all hope people will do?
Definitely call your state representative and your state senator. Those bill numbers are SB 31 and HB 44 again, and express your support. Specifically, expressing your support as a person of faith really makes a difference when we talk to those lovely staff people who are answering the phones all day long.
Yeah, these bills are already referred to committees. So SB 31 is in Senate State Affairs. and HB 44 is in House Public Health. So it's really important that we call those committee chairs and vice chairs and urge them to schedule hearings. These bills are both low bill numbers. They're priorities for the speaker and the lieutenant governor, but it's still really important that we call, especially like Jessica said, as people of faith and share that they have our support on this bill and that we really want to see it move forward.
Yeah, I'll echo. It is important to call as a person of faith, especially on issues like that some folks might assume people in the faith community might have alternative views on. Jessica, I'll give you a chance. Closing thoughts, shameless plugs before we close out.
Thanks for the opportunity to be here today. I think just one more thing that could be homework also is to make sure you talk to other folks about this too. We all said at the beginning that it seems like it's been forever, and yet there's still so much of the legislature to go. It can be easy for the average Texan to know about the things that come into the headlines here and there, and then either forget or not really engage with them. And so talking to other folks about this bill and make sure that they know it's coming and that they too can call and write in and show up at the Capitol for it as well.
Thank you, Reverend Jessica Kane. Kyle, I want to give you a chance to plug here at the end the reproductive policy team. Folks should join that, right?
Yes, absolutely. I also want to give a shout out to the folks who have been on our reproductive policy team. We've been meeting weekly for the last 2 years, and those women are just absolutely incredible. And not only have they been doing a lot of work on this issue, they've been doing a lot of work on other issues. They're on all kinds of teams for Texas Impact. But one of the things that we've been working on lately is this postcard campaign. We had photos of the postcards, big blown up versions of them at the press conference, but we're still doing this postcard campaign urging lawmakers to fix the Texas abortion ban. So that's exactly what we've been pushing, is the language that this law presents. And folks can still sign those postcards. We've got digital versions, we've got physical ones. We're encouraging you to pass them out, mail them to us. There's no deadline other than when a law is signed, when a bill is signed into law. So that is exactly what we want folks to be doing right now.
Love that. Good homework assignments. And I just want to say thanks again to both Reverend Kyle Riley and Reverend Jessica Kane for joining us today and for all of the work that you did this week to help get us to where we are now. So thank you both, and look forward to talking with you again soon. I hope you enjoyed this week's conversation with Jessica and Kyle. And for those of you who were at Faith Day at the Capitol, thank you for your incredible leadership and advocacy this week. It really did make a difference. It gave me great hope for the future. For those interested in getting involved in reproductive health issues, I hope you'll consider joining Texas Impact's reproductive policy team. Learn more about that or one of Texas Impact's other issue teams at the Action Center at texasimpact.org. Also on that page, you can find the weekly action alert or sign up for the rapid response team to get those emailed to you and get an invitation to the weekly Marching Orders Monday Zoom for a weekly update and conversation with B. I know we've been talking about reproductive justice for years now, and there is momentum to make some significant change. So now's the time for Texans of Faith to speak up and save the lives of Texas women. I hope we can count on you. If you have questions about anything from today's episode or want to talk more about how you can get involved, please reach out at scott@texasimpact.org. While you're on the website, I hope you'll take a moment to sign up to be a member of Texas Impact. Your membership supports this podcast and all of the work to engage Texans of Faith to advocate for more just and equitable Texas. And again, this week, before we go, since I don't think we'll do a podcast on this in the near future, make sure you are getting your vaccinations. It is 2025 and we have a measles outbreak. For goodness sakes. Come on, Texas, we can do better than this. So with that, I think it's time to close out this episode. So remember, the world needs Texans of Faith active and engaged. So let's get to work. I hope you enjoyed this week's conversations with Jessica. There's only one conversation. I hope you enjoyed this week's conversation with Jessica and Kyle. And for those of you who were at Faith Days at the Capitol, thank you for your incredible leadership and advocacy this week. It really did make a difference and gave me great hope for the future. For those interested in getting involved in reproductive health issues, I hope you'll consider joining Texas Impact's reproductive policy team. Learn more about that or one of Texas Impact's other issue teams in the Action Center at texasimpact.org. Also on that page, you can find the weekly action alert, toll-free numbers for legislators, or sign up for the rapid response team to get those action alerts emailed directly to you and get an invitation to the weekly Marching Orders Monday Zoom for a great weekly conversation and update with B. Y'all, I know we've been talking about reproductive justice issues for years now, and there is momentum to make some significant change. So now's the time for Texans of Faith to speak up and save the lives of Texas women. I hope we can count on you. If you have questions about anything from today's episode or want to talk about how you can get involved, please reach out at scott@texasimpact.org. While you're on the website, I hope you'll take a moment to sign up to be a member of Texas Impact. Your membership supports this podcast and all of the work to engage Texans of Faith to advocate for a more just and equitable Texas. I did this last week, and I want to do it again today because I don't think we're going to do a podcast on this in the near future. Y'all, get your vaccinations. It's 2025, and we have a measles outbreak. For goodness sake, come on, y'all. We can do better. So with that, I think it's time to close out this episode. So remember, the world needs Texans of Faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnet, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.